Dr. Bella, let's talk about a root canal. Number one, tell us a little bit, tell us of what a root canal is. Is it really, you're taking out the root of the tooth, and also tell us of how it improved over the years. People are awful afraid about a root canal. I mean, it must be the biggest joke out there that when you do something unpleasant, you go and say, well, this is like a root canal. And yet I don't think that's really true anymore.
I can tell you, Helmut, in my practice, everyone that walks in looks forward to having a root canal.
Sure.
It absolutely, if you say that to someone, it for whatever reason, it connotates probably some of the biggest fears that I've ever seen. So it has improved drastically throughout the years. And this first, let me just go over why one does a root canal and what it is for. A root canal, and in our office we use the kinder, gentler, more politically correct term of root therapy, because that's actually what you're doing. You're going down and you're performing a therapy within the roots of the teeth. Whenever decay or trauma or pressure or something starts to affect the nerve of the tooth a lot of times can die. And when it does, it builds up a pressure inside of the tooth. Patient usually knows that's happening because they'll get a toothache. That's the classic reason why someone gets a toothache. So the whole idea...
So let me ask you something right here. Does a toothache almost all the time or all the time mean root canal therapy?
Not all the time, no. It does not mean that. There can be a variety of reasons why people get a toothache. A sinus problem can give you a toothache. You've had a trauma on the tooth, that could give you a toothache. You just bit into some ice and all of a sudden your teeth ache and they ache for a while. So there's a variety of reasons why people get a toothache. I would say probably the most common reason that people get a toothache that lasts is because of decay or breakdown of the nerve of the tooth, which then does require root therapy.
Okay. And on a root therapy, what are you doing there? What is, stay away from technical words, of course, but what is it you're really doing there?
Well, if you think of a tooth, and let's take a front tooth because that's the easiest one for people to visualize, and get the idea that it sits in there kind of like an ice cream cone sitting in your mouth, and the top part of the cone is what you see from the gum line, and you have the root of the tooth, which is the remainder of the ice cream cone sitting below the gum line. Mm-hmm. Inside of that cone is where the nerve and the blood supply sits. And when you're doing a root therapy, you're cleaning out the infected inside part of the root. So you're not actually taking out the roots of the tooth. You're actually taking out the small contents and cleaning out the inside of the root of the tooth. That's basically what a root therapy is comprised of in its first step. After it's cleaned out, then you fill the inside of the tooth with an inert, usually kind of like a sealer and a rubberized type of material, so that nothing can get back down in that canal once again and infect and cause a pressure on that tooth.
I see. All right. Well, and tell me, why is it that sometimes that all dentists actually keep saying that you need a crown, a cap, after you did a root canal in almost all cases, yet many people don't have one, they don't get one, it's a money matter sometimes, and years later the tooth is still okay.
I would say almost everyone that has had a root therapy or a root canal needs proper crown support on the tooth. Usually there's a lot of tooth structure, if it broke down because of decay, that's gone, and the patient will readily see that, boy, we really need to rebuild this tooth. If it's a trauma to the tooth, a lot of times the root therapy can be conservatively done so that when it's finished, right away you may not need a cap or a crown on it. But get the idea that if part of the tooth structure, or if it's a big filling and it broke down, that after you perform the root therapy, the tooth actually becomes slightly brittle, because not only did the nerve of the tooth contain the nerve part. The canal contained the nerve part. It also contained the blood supply, which nourished and kept that tooth alive. So now it becomes kind of like a stuffed animal in there. Get the idea that it's a little bit brittle, and you want to support it with a proper build-up and a cap or a crown on the tooth so the tooth is re-strengthened, and it can take the forces mostly of chewing in there and function like a tooth is supposed to function.
Because obviously the root canal, by putting that hole in it to clean it out, you made the tooth kind of like a pipe, I guess, right? And
precisely, exactly.
And it becomes, you say it also over time might become more brittle because you fiddled with the nerves and stuff like that, so it doesn't get as much oxygen or nourishment.
Yeah, right. Well, exactly.
So you have two reasons. So basically what you're telling me, a person might and might not, basically what you're telling me is a person on an average is relatively lucky if his tooth doesn't break after a root canal within short or not so short time.
Exactly, Helmut. I've seen many, many patients, and once again, some of them for very legitimate or financial reasons, get the root canal done on the tooth. Well, as soon as you do, the tooth is going to feel better. You've got the infection handled in the tooth. And even if you do what's known as a buildup on the tooth, the part of the tooth that's scooped away on the inside, if you do a buildup on that tooth, it still becomes brittle, and the patient gets a false sense of hope or reality on the tooth. They start chewing on it, they start eating on it, which is what they're supposed to do. And then the next thing you know, it's 6 months down the line or a year, or possibly even longer than that. They fracture the tooth off. Okay? They're not going to feel it because the tooth's been root therapied. It's been root canal.
Oh.
And a lot of times that tooth will fracture way down inside the jawbone where you're digging out the roots and you're digging out the rest of the tooth, and that's fairly unpleasant because all they really needed to do to complete the project was to get the reinforcing and strengthening crown or cap on top of the tooth, and they would have eliminated that whole fracture business.
I see. So again, we're talking about, okay, you may save a few $100s now, but then you add those few $100s plus an implant, or do it for 3 teeth because you need a bridge.
Right, exactly. And
so basically you're quadrupling your money, never mind having to see you, the dentist.
Well, exactly. And stop and think, if you lose the tooth, okay, there's one of two ways you're going to replace the tooth, and that's with an implant or a bridge. And guess what? Either one of those are still going to have a crown on it. So you're back to the crown, a lot of additional work, a lot of additional expense and aggravation on getting the root tip out, on getting an implant body in, or, preparing the other couple of teeth for a bridge, once again, after they have to dig out a root tip. So a lot of extra work, time, effort, and expense. The rule of thumb is, if you've had the tooth root therapy, get the crown. You'll be happy you did.
All right. From your mouth to our ears.
To the video.
Okay. Bye-bye, Dr. Petta.
Okay, bye, Helmut.